All right, so veterinary pharmacology. Veterinary pharmacology is the study and the use of drugs in animals. There's some terms that we're going to talk about. Pharmacotherapy, this is the treatment of diseases with drugs. Pharmacotherapeutics is the drugs that work within the disease. So they do pharmacotherapeutics when they're developing them. Pharmacodynamics is how drugs work within the body. And then we have pharmacokinetics, and this is how drugs move through the body. And we'll talk more about pharmacokinetics in the next lectures. So we have A for absorption, D for distribution, M for metabolism, and E for excretion. And we'll talk more in the next few lectures. So, drugs. Drugs in the United States, they have regulations. They're regulated by the FDA. And in 1968, the Animal Drug Amendments put the regulation of animal drugs under the FDA's umbrella. The FDA has established another group called CVM, and this is with the DEA, and it ensures that veterinary medicines are safe and that the benefits of the medicines for the animals outweighs the risks. A few other regulatory bodies, the DEA, they regulate the Drug Abuse and Prevention Act of 1970, and then the USDA, they regulate biologicals. So, on to medications. There's 3 types of medications. The first type is over-the-counter, and these started happening in 1972. Okay, and basically what happens with over-the-counter drugs is these are drugs you can purchase in the store. Okay, you don't need a prescription. You don't need a prescription. Okay. You can just go to the store, buy some Benadryl, buy some aspirin, buy some Tylenol. So basically what happened is they have discovered that these are relatively safe, okay? The problem with people using over-the-counter medications that aren't prescribed by the veterinarian is they can mask other diseases. So there might be some other things going on with them. There's also species differences. A cat cannot metabolize aspirin. Okay, it metabolizes it very slowly. An aspirin tablet in a dog may take 8 hours to get out of their system. In a cat, it may take 3 days. Okay, another big one that we have to think about, Tylenol in cats is extremely toxic because they are lacking the enzymes to break it down. So just because it's over the counter doesn't mean that a client should give it. The other ones we see, the second type is prescription. And these you need that VCP. So you have to have the veterinary client-patient relationship. The veterinarian must examine the animal. And on every bottle that you will see, there's a legend, and if it's a prescription drug, and the legend says, caution, federal law restricts use of this drug by or on the order of a licensed vet. Okay, so you'll see this legend here. There's some other things that we do. We do extra label use. This can be done. A veterinarian is allowed to do it. It does need to be tracked for food animals. So there's the food animal residue and avoidance database. Okay, this is where they need to track the information when they use extra label drugs for food production animals. Controlled substances is our third type of drugs. This was established in 1970. Okay? There are 5 schedules or classes. Okay? It's based on the potential harm and the risk of addiction. All controlled substances must be stored in a locked cabinet or a safe. They need to be attached to the floor. The safe needs to be attached to the floor of the wall. And we need to make sure we are taking controlled drug logs as well as an inventory. You do have to keep track of this. The DEA can come in at any time and review your records and make sure that you are using them appropriately. Okay, so how how do you know what schedule these drugs are? Well, every scheduled drug or controlled drug is going to have a Roman number, a letter, and then a Roman numeral after it. So Schedule 1 or Class 1, these are drugs that are high risk for potential, and they have no medical use. Okay, even marijuana, heroin, and LSD, there is no known medical use of these. Okay, C2 or Schedule 2 drugs, these have some risk of a dependence. They have some medical use. Okay, cocaine and morphine are some of these drugs that are in the Schedule 2. Schedule 3, these do have some risk of being addictive, but they have more of a medical use. And these would be drugs like you're going to see in clinic, like ketamine. Steroids are considered a controlled drug because of the risk of abuse. Okay. Then we have Schedule 4 or Class 4. These have not as much risk. Okay. They have lots of use in the medical field. These would be like butorphanol or diazepam. And then C5, these have little risk of being addictive. They do have a lot of use in the medical field. This is kind of where they go before they jump over to the prescription side. And drugs that you'll see in this are buprenorphine and cough syrup with codeine.